so that we can build our discussion how your realities really intersect with those public health aspects. So 85% of deaths in Egypt are due to NCDs. It's not bad. Why? Because who wants to die because of injuries or infectious diseases? I'd rather die because of NCD. But what I want to do is die in older age because of NCDs. Having lived a healthy life, that is called the concept of compression of morbidity. But this is not the case. We have, how do I advance this one? What we have is that we have this is the slide that, oh, am I doing something wrong? Is there something wrong here? Oh, so what we have in Egypt and in many countries around the region, we have high rates of premature NCD mortality. So it's not that NCDs kill; they kill and maim at younger age, and affecting the most economically productive part of the society. This is the main target. So in Egypt, 50% of NCD deaths are premature. This is our main challenge. So we fortunately have a vision. We are repeating some of the concepts that were presented in the animated infographic, because these are really crucial issues. We have a vision that's based on 3 pillars endorsed by the World Health Assembly in the year 2000 and led by our current regional director, Aswan. This is based on surveillance, prevention, and management. Now, you as practicing physicians, as well as academics, as I see these are the 2 audiences in the 2 types of audiences we have had in this conference, have a role to play in every single aspect, and this is what our discussion will be focused on. So this is not very broad government work. This is your day-to-day reality, and we are going to discuss what we can do together. Now, this was not formally placed in the year 2000 as part of the global strategy, but it's now recognized that you really need strong leadership at the national level to make this happen. We're going to discuss this further. Adil already discussed the 2011 UN Political Declaration on NCDs. The NCDs have reached the United Nations General Assembly. It is only the 2nd issue after HIV to reach the Jam'iyya al-Umumiyya al-Umam al-Muttahida. This tells us about the huge economic and social burden that world leaders see coming from NCDs. We must act. Now, we have had, after that meeting in the year 2011, we have had the first interim review in 2014. There's some progress. Our region is not doing well. So there's much more to be done. Now, we got another boost from the UN General Assembly, which is the adoption of NCDs as part of the Sustainable Development Goals. You probably remember the Millennium Development Goals. Those did not include NCDs. As of September of last year, NCDs are part of the Sustainable Development Goal. Now, we have a target for 2030 to reach those Sustainable Development Goals, including reduction of premature CAD mortality. Can we do this? We can, with your help. We're going to discuss this further. So we have now a long way from the time when the global strategy on NCD control and prevention was first formulated, all the way to 2013, when we need to meet the Sustainable Development Goals with regards to NCDs. So we now have all the tools that we needed. It's been brought to the UN General Assembly, to the World Health Assembly. Really, the time to ask is now, as the infographic said. Now, we even not only have a vision about what to do, we actually have specific targets. And those targets were endorsed by a World Health Assembly. So it's no joke. Our ministers committed to achieving these targets. But the governments cannot do it alone. And this is the importance of the initiative that Adil and his colleagues have initiated with the launching of the Egyptian National NCD Alliance. And we are going to discuss how we can work together to make this happen. In relation to those targets, some of these targets are right down your alley. It's what you do every day. Drug therapy and counseling for people who are at high risk for cardiovascular disease and the related complications, the provision of essential medicines in primary healthcare. This is all your daily realities. A lot of the other ones are population health intervention. We'll discuss how you play an important role in these population health interventions as well. This is what guides the regional action. This is what your minister, my Minister of Health, has endorsed. This is called the Regional Framework of Action to implement the UN General Assembly Political Declaration on NCDs. And as you can see, there are 4 areas that correspond to the same global strategy we discussed. We discussed the issue of prevention, surveillance, and treatment. And of course, there's the overarching governance that we discussed as well. Let's review a few things so that we can know what governments have committed to and ask ourselves, what can the Egyptian NCD Alliance do to hold our governments to account and help the government achieve this ambitious program. So with regards to governance, we need a national plan. Unfortunately, Egypt has not yet come up with a national plan or set national targets. So we have global targets that we have endorsed, but we have not yet set national targets for Egypt. As a matter of fact, many countries in the region have not done so. So this is what the alliance can do. This is what you can do as being part of the alliance in your national associations, society, professional societies can do, is that we need to push for this because it's something that our governments have endorsed. In the area of prevention, the FCTC, you know, you go around the hotel and there's smoking every place, in public places. We have a challenge to implement a treaty that we have actually endorsed as a society, as a country, Egypt as well as other countries in the region. We're not doing well on implementing a treaty we endorsed. So in the area of surveillance, we might be showing you numbers, but these are not real numbers. These are estimates. We have not had a recent national survey in the past 5 years, as is endorsed by the Regional Framework for Action in many countries in the region, which means that we have to integrate surveillance into your daily works, so that we don't have to do a very expensive survey in every 5 years, so that information is generated from daily work. And of course, in the area of healthcare, are we doing well with regards to identifying high-risk people? Not quite well. Are we doing well in treating these hard people with either counseling or drug therapy? Not yet. This is a crucial area of your work. Perhaps you will see yourself more in this area than in any other area, but in the discussion we'll discuss your role in even implementing population health interventions. Millions of lives can be saved in the region through implementing these risk factor interventions. This is just an example of the implementation of risk factor targets. The blue will show you here what will happen in a business as usual scenario, which is what we're doing right now, which is not a lot. And this is what can be accomplished if we implement those risk factor targets. Millions of lives can be saved. Now, this is I would like us to, this is my slide telling me that my time is out, so I'm going to close in a minute. This will tell us about where achievement of raised blood glucose contributes to the other things. But as a matter of fact, when you see people in your clinics, in your centers, you don't just address raised blood glucose. Even if you are an endocrinologist as a specialist, you address all of the other issues. You hopefully will be addressing obesity, salt intake, all of these things. So, so you have a huge role to play. Let us remember that healthcare interventions, what you do, can contribute a third to the reduction of premature mortality. So 2/3 of the reduction will come from population health interventions, implementation of the FCTC or so, but you contribute a third at least. But you can also contribute to those 2/3 if you deliver population health intervention in your clinics. For example, if you're a family practitioner who you are seeing a family. Now, if you are implementing prevention advice, you are delivering a population intervention at the family level, because you are preventing that young child from picking up smoking or using excess salt later on in life. Now, there is a well-established understanding of what it takes to do this for practitioners. This slide is aimed at you only. You are the practitioners, you are delivering services, but everyone understands there's a health system that needs to support you. Now, the health system is not doing a great job in many countries in the region, so we need to push here. There's a community that's not engaged in NCD prevention and control, and this is the importance of the NCD Alliance in Egypt, because it will not just mobilize doctors and others, healthcare providers, but it will mobilize communities to speak out. Nam earlier spoke that the IDF is the voice of people with diabetes. This is where they can come to account.
Time, Samir.
Okay. Great. Why don't we move then into Dr. Wael, so he